You're listening to BioTalk with Rich Bendis, the only podcast focused on the BioHealth Capital Region. Each episode, we'll talk to leaders in the industry to break down the biggest topics happening today in BioHealth.
Hi, this is Rich Bendis, a host of BioTalk, and we have a unique guest with us today. It's the first time we've interviewed a real biohealth entrepreneur for BioTalk, and we have Jonathan Cohen, President and CEO of 2020 GeneSystems, located in Montgomery County, Maryland, and has been here for several years and has been a recovering lawyer, he said. So, Jonathan, welcome to BioTalk.
Glad to be here, Rich.
Let's give the listeners an introduction to you personally and how you have evolved from being a lawyer to an entrepreneur.
Sure. Thank you very much. And thank you for having me, Rich. Let me just begin by acknowledging the important work that you and BioHealth Innovation do here in Maryland, and also your newsletters. The Innovation Daily, from my standpoint, is required reading for any entrepreneur throughout the United States and around the world. I don't think I've missed one by and large. It's about, I believe, close to 365 days a year, and it's fantastic. And so I just want to express my appreciation.
Thank you very much for that PR, Jonathan.
So 2020 GeneSystems, based in Rockville, Maryland, our mission is to reduce cancer mortality in the United States and around the world through early detection. Our approach is to use what are called biomarkers. These are proteins in the blood. And we are using actually mature biomarkers, older biomarkers, not next-gen sequencing, but our novelty is actually in the analytics. We use machine learning algorithms to improve the performance of these markers. And I'm happy to elaborate on that. My own background, for your question, you're right. I'm a patent attorney by background, so I have a Master of Science degree from Johns Hopkins University in biotechnology and also a law degree. And I practiced in a law firm. One of the partners in the firm in his late 50s was diagnosed with advanced kidney cancer. And in helping him identify treatments, it became clear to me that there was so much more that needed to be done. I wanted to be a little more a part of it, and I became in-house counsel for two local publicly traded cancer diagnostics companies. One of them turned out to be quite successful. It eventually was acquired by Roche Diagnostics for $3.5 billion. So that was my background prior to starting 2020. But as I said, our current focus and mission is to save lives, to prevent lethal cancers through early detection, with a particular emphasis on using AI and machine learning algorithms. And
prior to your corporate careers, had you had any inkling that you had this desire to be an entrepreneur?
In some respects, I sometimes felt that I could run my client's business better than they could. That's not a good thing to do when you're in private practice. And it was probably, once that happened, it was time for me to leave. So I've been doing this for some time. We've drilled down some dry holes and run through some blind alleys. But I feel that now we have finally identified a technical approach and business model that will allow our company to scale not only in the United States, but around the world, especially the Far East. China, Korea, Japan, and that's a whole discussion in of itself. The approach that in that part of the world they use to disease prevention is radically different than what we do in the West. And that essentially became the underpinnings of our current business model, which we call an East to West business model.
And I'm sure we're going to elaborate on that a little bit more, but I want to back up a second. And you made an interesting comment about being on the other side of the table, thinking you could run their businesses better than they. Now that you're on this side of the table, running your own business, is it as easy as you thought it was?
Not at all. Not at all. And there's a lot of challenges, of course, especially when look, cancer is tough. Obviously, if it wasn't hard to detect, hard to treat, and if it wasn't so hard, so many of our friends and family members wouldn't succumb to the disease. So we're in a tough field. The financing is a never-ending challenge. I know that's been a theme of BioHealth innovation. I have, over the years, been fortunate to innovate and to have some leadership and some new approaches, which I think we're going to talk about. But we are part of what Steve Case calls the other 47, being in Maryland. We're something like 75% of all venture capital goes to companies located in only 3 states. California, New York, and Massachusetts. So the other 47, Maryland and the rest, need to come together and work on expanding new initiatives for helping companies get the capital they need so that CEOs like myself can spend more time executing their business plan and less time running around hat in hand trying to raise money.
Yes, this valley of death, innovation capital valley of death, is real around the world. And I've also talked to people in Boston and Silicon Valley. Sometimes it's not as easy for the early entrepreneurs who aren't serial entrepreneurs with a great reputation that are investable immediately, that have the same challenges we have here in Maryland.
Indeed.
Let's drill back down on 2020 GeneSystems. Let's talk about the company a little bit. You mentioned machine learning, and right now AI, artificial intelligence, is something that you hear about as much as any technology in the world. So tell us about the interaction with AI, machine learning, and what you're doing at 2020.
Sure. So our first product in the cancer arena is a blood test for early lung cancer, which we have had available for a few years now. That brought me to China, which has the world's largest smoking population. There are more smokers in China than there are people in the United States. And coupled with heavy air pollution, that made it a particularly important market. But when I spent time in China and Taiwan and neighboring countries, I learned something that most Americans, even medical experts, don't know. And that is, so the average American, if they get a physical, and men like us often don't get annual physicals, but get maybe, 10, 15 minutes. The battery of tests that we do to screen for cancer today haven't really changed since the early 1980s. We screen for colon cancer, prostate cancer for men, and women, breast and cervical. That's it. That was what we did when Ronald Reagan was president, and that's what we do today. That is not the case in Korea, Taiwan, Japan, Singapore, and mainland China. The average middle class to upper middle class individual gets a half-day physical at something called a health check center. They don't treat health check center. It's a pure screening, and they get a battery of blood tests and imaging. And this has been going on for, probably close to 2 decades. So being a blood biomarker company, we quickly realized that there's a tremendous opportunity. To the best of our knowledge, no one has built a business harvesting the data from these institutions and trying to, understand how good these tests are and then improve them using analytics. And algorithms have been part of 2020's technology from the beginning, so we have a lot of expertise. So we partnered with one particular top-notch hospital, happens to be in Taiwan, and they did an analysis of their blood test in their health check center and found that it basically they went back and looked at the records from individuals, over 40,000 of whom had been screened over a dozen years. And Taiwan has a strong national health registry, so they were able to figure out who came in to get checked and who ultimately had cancer, and went back and looked at how good the test was. And they were picking up just over half of the cancers, which is good but not great. So we partnered with them, and we used a combination of biomarker experts, laboratory medicine types, and analytical experts, bioinformatics, machine learning, and so forth. So we created bidisciplinary teams on both sides of the world, and we have shown that we can take the standard testing that they do tens of thousands of times a day in that part of the world and improve what's called the sensitivity, the ability to detect cancer if it's there, by at least 30%. Same equipment, same biomarkers. What we're doing now imminently is bringing that into the United States, a product which we call One Test, which we hope to launch as early as the second quarter of the new year, at least on a small scale, where an individual once a year can get one tube of blood, simultaneously screen for 5 or more cancers. That's what we are going to be doing, and it's backed by data from tens of thousands of individuals, initially from East Asia, but over time we're integrating data from Caucasians, North American populations, Europeans, and so forth. So that is our current focus, the introduction of One Test in 3 or 4 months, and we're very excited about it. Market research suggests Americans do want to do more than sit around and waiting for that phone call from the doctor where they or a loved one has advanced cancer. Most cancers, a lot of people don't realize that most cancers are not lethal. Metastasis is lethal. The 5-year survival rate of a stage 1 screen-detected lung cancer approaches 90%. In contrast, the 5-year survival rate of a stage 4 lung cancer is about 2%. We should be doing much better. Through screening and prevention, we can get these patients with confined tumors to a surgeon, have it surgically removed before it spreads, and the patient has an excellent prognosis rather than waiting until they have advanced cancer and are given 6 months to live. That's our mission. That's what we are now doing at 2020.
That's a great mission, and I hope you're successful with that. As an investor myself, one or two things that I ask any entrepreneur with a new product or service that is extremely important before they are eligible to be invested in would be related to who's going to pay for your test and what kind of regulatory approvals do you have to go through. So talk a little bit about your one test, where you stand from a regulation standpoint, as well as what is the payment vehicle.
Excellent questions. And those are the two most important issues and challenges, frankly, that have faced the diagnostics field in particular. Let me begin with regulatory. There is, for lack of a better term, a new sheriff in town. Scott Gottlieb, FDA commissioner, appears to be very, very different than his predecessors. There are a number of guidances that have come out since the elections a year ago that give innovators like 2020 GeneSystems some reason for optimism. Right now, it appears that both what are called laboratory-developed tests, which are tests done in a single lab, and what is called clinical decision support software. So our business model in the United States is that we're providing the algorithms on the cloud, and other labs will be able to run those tests. A piece of legislation a year ago called the 21st Century Cures Act passed, which exempted the clinical decision support software from the FDA regulation. Now, the FDA has not yet issued its rules on that, so we'll see. But we are optimistic that the FDA is taking a bit more of a relaxed stance than its predecessors. That doesn't mean that it's not the Wild West. There are going to be limits. And we are a science-based company, and if and when it becomes time to seek approval from the FDA, we want to be ready. So as we do this so-called launch, we are doing what is called a real-world evidence, or RWE, study. We are going to be collecting the outcome data and using that over a period of 2 or 3 years to build the clinical case here in the United States, not just in the Far East, here in the United States, of the value of these tests. So that is part of our approach. A few weeks ago, Commissioner Gottlieb was quoted in the Wall Street Journal saying that in some cases, AI might even replace clinical trials in some respects. So that's something you would hear from a Silicon Valley guru, but you wouldn't normally expect to hear from a Washington insider. So we're upbeat, but we're also acting in a very deliberate, very responsible way, so that if and when regulators and others want the data, we're there to back it up. Now, let me turn to the reimbursement question, another challenge. In the United States, the medical establishment has been very conservative about screening. We're still debating the mammogram. We're still debating the PSA. So we have no immediate plans to seek Medicare and Medicaid reimbursement, or even the insurance companies. This will be, our lung cancer test is today, and one test will be soon, a self-pay product. By and large, in the Far East, most of these tests are paid for by employers, and supplemented by employees if they want to have more biomarkers tested than their current plan. So we've done market research here. We believe that the average American will pay just under $200 once a year if they can simultaneously screen for 5 or more cancers. So the test will be probably in the $150 to $200 range, and we think the market will bear that price. The day will come when we will seek CMS reimbursement and Blue Cross Blue Shield, but not next year, and probably not the year after. So we're building the case, and we're getting and we're optimistic that will happen. One recent piece of evidence of that, and I don't want to jump ahead, but we've as you know, initiated something called an equity crowdfunding campaign, and we can talk more about that. But the 470 or so people that have so far invested in our company over the last 6 or so weeks, many have invested up to a level to get an early voucher for one test, is a positive sign that there is a self-pay market in the United States for this type of test.
So now that you've mentioned it, and I was going to get to equity crowdfunding, you have been an advocate for innovative financing for entrepreneurs for many years. And I'm going to come back to crowdfunding because that's more current. But before that happened, you were active in working for a biotechnology investment tax credit in the state of Maryland, which is proved to be one of the more successful investment vehicles for high-risk accredited investors to invest in early-stage companies. Let's talk a little bit about your role in that and the history with that program.
Great, and thank you. And I'm very proud of the Maryland Biotechnology Investor Tax Credit. I conceived of that initiative and led the legislative effort over many years to have it implemented and sustained and grow. It is, without exaggeration, by far the most effective investor incentive in the United States. I've spoken to investor groups from coast to coast, and no one has challenged that. For those unfamiliar with it, it's called a tax credit, but it's really a refund. Investors, those who invest as little as $25,000, as much as $500,000, can get half their money back from the state of Maryland, usually within about a year, including people who don't pay taxes in Maryland. They get an actual refund because it's a refundable tax credit. They get a check. And I also initiated a parallel program called the Montgomery County Tax Credit Supplement, where you get, it turns out to be around 5%, sometimes 8%. So
8% of what you got from the state.
No, 8% of the investment.
Of the investment.
So
okay.
Somebody, to keep the math simple, somebody who invests $100,000 in a qualified Maryland biotech company who happens to be in Montgomery County can look forward to getting at least $55,000 of that back from the county and state. There's really nothing like it. It has inspired other programs around the United States, but none to my knowledge have come quite to that level. It is so popular that last year, which was unusual, the state's fiscal year begins midsummer, the program was oversubscribed in a fraction of a second. Literally, those that may have logged in 5 to 10 seconds late. As an aside, there was a technical glitch. I'm not going to bore your listeners with that, but we're working through that. But that shows you how important it is. So it's very important in the upcoming legislative session that the governor propose and that the General Assembly accept, I believe, a doubling of that allocation from $12 million to $24 million. It is like nothing else. We have an array of good programs in the state of Maryland, but this one is exceptional. And it's important because it's not a grant. The marketplace is picking winners. The state is not picking winners. There are other programs where it does that. It is the marketplace, and it's hard to raise money, even with the tax credit.
And the other thing is, I think the investors don't have to be from Maryland.
That's exactly right. That's very important. We've had Canadians, they don't even have to be from the United States, as long as they pay taxes somewhere, not Cayman Islands kinds of things, but we've had them from around the world. Others have as well, but probably 10 or more states. So the investors can come from anywhere, and they get literally a check. And it's really a very effective program and something I'm quite proud of.
I agree with you. I think it's one of the best early stage investment programs in the United States. And the other thing is, most people don't know it, Montgomery County, to the best of my knowledge, is the only county in the United States that has an investor tax credit program like that.
I think that's correct.
It shows you how progressive we are within this industry within our backyard. So that was one program which you've been influential with and actually have benefited from with 2020 GeneSystems.
Sure.
Another program, which is a federal program, which I think you're also an advocate for, is the Small Business Investment Research Program, SBIR program in the federal government.
Right. And this is something I also, as part of a coalition about 4 years ago, led an effort, very difficult legislatively on Capitol Hill, to increase the allocation from what was then, I think, 2.5% of all federal agencies that do R&D, like NIH, DOD, and so on. We got that. It is now, I think, 3.2, 3.3%, which doesn't sound like a lot, but when you multiply it by the NIH's $30 billion budget, that does add up. So that was hard fought. To be frank, it was the academic lobby fought it tooth and nail, but in the end, that went up. It's still much too low. I believe the European Union Biomedical Research Authority allocates almost a third of their grants to what they call SMEs, small, medium-sized enterprises. That's probably about right, maybe 20%. The NIH and the other agencies, whether it's and NASA or Department of Agriculture, need to allocate at least, in my view, at least 20% of their grant money, their extramural research, to small and emerging companies. If you want to deliver a product to a patient, not a paper, you need to turn to an entrepreneurial company, and that program is life-sustaining. It's simply too small, and it needs to expand, in my view.
Well, I agree with you. I doubt that we're going to get to that 20% level, but it's wishful thinking.
Indeed.
And it's something that we can target, but if we could get to 5%, that would be a neat goal.
We would take that, too.
Yeah, and for most people who are listening that have never heard of the SBIR program, there are 11 federal agencies that have research budgets in excess of $100 million. The total SBIR budget annually is $2.5 billion. And small businesses like 2020 GeneSystems have the ability to apply on a competitive basis for a phase 1 or a phase 2 or even a phase 3 or other forms of SBIR grants. And the beauty of the SBIR program, you don't have to pay it back. You don't have to mortgage your house. You don't have to give up equity in your company. It's the purest form of seed capital available for entrepreneurs in America. And I would imagine you would agree with that.
Indeed, absolutely.
Great. So now that we have talked about the tax credit program, SBIR, let's go back to where you started talking about creative financing with, let's say, innovative financing, not creative financing. Creative financing might have a different connotation. But innovative financing with equity crowdfunding and how you have studied that particular financing vehicle and what you have done with equity crowdfunding to benefit 2020 GeneSystems.
Great. Yeah, and I'm very, very bullish, very excited about this. Let me provide a little historical context because people aren't aware of just how profound this new environment is. All of us that have been around for 4 or more years have been trying to raise money under a 1930s securities system that was imposed right at the time of the Depression. And has changed very little since then. About 4 years ago, Congress approved and President Obama signed into law something called the JOBS, J-O-B-S Act. And the JOBS Act had a number of titles. But the ones that I think are most relevant to emerging growth companies, not simply in the life sciences, but in all fields, technology or otherwise, are something called equity crowdfunding. And there's different flavors of equity crowdfunding, one of which allows you to solicit to accredited investors using a megaphone, podcast like your own, or other things. That's important. Others that allow entrepreneurs to procure investments from accredited and non-accredited investors, which I'm going to get back to because I think it's extremely important.
Let's define an accredited investor for our listeners, for those who don't know what that is.
Yeah, I'm a little rusty on exactly. I know they changed it, but I think it's income of about $250,000
$200,000 a year.
Okay, and the network of $1 million, not including your house.
Real estate. Right.
I think that's only about 4 or 5% of America. So what we now can do to cut to the chase, and this is what's so exciting, we can now raise capital from everyone, and 2020 is doing just that. So with equity crowdfunding, we started doing it about 6 weeks ago on a platform. You can't do it on your own. You must do it on an SEC license, what they call a portal. Ours happens to be microventures.com. It is the equity arm of a company many of your listeners are familiar with, Indiegogo. Indiegogo, like Kickstarter, was a rewards-based crowdfunding for many years and very successful. And they were one of a number of organizations that jumped on this bandwagon. If you look at Microventures, you will see us next to food trucks, distilleries, movies, and things like that. It's frankly mostly been lifestyle companies. I don't believe that it has to stay that way. We're doing, by and large, better than most of those other ones. I think as of today, we've raised just under $250,000 from 470 or so individual investors around the world, actually. But what's important about equity, it's not just a financing source. And I think when the campaign ends, I would hope we would be close to $400,000. It's not bad for 2 months. But we can then do it again and again. There's different types of equity crowdfunding. One type, by the way, allows you to go public, called Regulation A, or often known as Reg A+. That's equity crowdfunding on steroids. But to 2020 in life science companies, I think it's extremely important that we be able to reach the individuals that can benefit from our products. Cancer doesn't care about your net income or your annual, what your net worth is. It doesn't discriminate based on your wealth. So we want to reach people of all economic levels that can be customers, that can be ambassadors, that can go to their doctors or practitioners said, I'd like you to not only give this test to me, but you might want to offer it to your other patients. So I'm hoping that these 470 will hopefully be 600 or 700 people when all is said and done, will not just be investors, but they will be early adopters. They will be customers. They will be evangelists, if you will. And I think that can work. Now, we are a little bit more of a consumer-facing company. So right now, out of the gate, I don't know if a therapeutics company, for example, that has a 5-year window would out of the gate do very well. But I think over time they might. And I would encourage other life science entrepreneurs to give it a try. It's not terribly expensive. And once you do the front-end work and all the legal work up front and the accounting, it goes on autopilot. You basically what I often say is you can raise money in your pajamas. I go to sleep at night, wake up, and I've got a couple more shareholders, and I might have raised $1,000 overnight. Not bad. You don't have to get on planes and trains. You don't have to answer a lot of questions. Their questions are posted on the site. So you answer the questions not individually, but for everyone. So I'm very excited, and I think it has a lot of potential to scale in the next 2 to 3 years, and it may actually usurp traditional venture capital as we know it.
For people who are still somewhat unfamiliar with crowdfunding, if I'm one of your 470 investors who's already invested now, I did the math. It's probably an average of like $500
That's exactly
person.
Right.
Tell me, how does that investment get made into what? And what does the investor get for $500?
So they get equity. In our case, they're actually getting preferred shares, the same class of stock that are so-called sophisticated. Not that these are unsophisticated. I think they are sophisticated. But the so-called professional. So we have raised money through a national angel network, one of the largest, called Keiretsu Forum. We raised money from the venture capital arm of the largest health insurance company in China. These crowd investors, and the SEC is very careful about this because they don't want you offloading a lousy term sheet onto the crowd. So we're giving them the same class of stock at the same valuation by and large that the others invested in. You don't have to give everyone voting rights, so it's not difficult to manage. They all give proxies to the investment banker that has the portal. So we don't have to go to these 500 or whatever people every time we want to elect a director and whatnot. So, time will tell, but I think it's a manageable process. A lot of people are scared about having so many shareholders on their cap table. I think that fear is somewhat exaggerated. Time will tell. I may change my mind over time, but so I think it's a very exciting mechanism for many companies, and I'd love to see more biotech and medical device companies giving it a shot. And even if you raise $50,000-$70,000, it's certainly something. And again, you're building brand awareness. You're building a constituency.
Let me ask you a question about our region. I've been focused here with BHI now almost 7 years, and one of the things I see as a challenge is we're not really early adopters. We tend to be very conservative in this region. It's almost like being from Missouri and it's the show me state. So at the end of the day, what do you see as the challenge for entrepreneurs in this region that don't take advantage of some of the unique financing vehicles or opportunities that other entrepreneurs in other parts of the country are doing right now? Well,
we are part of the other 47, and I don't think that we're radically different than companies in Ohio or Texas and so forth. I think there are special challenges with being in the shadow of our nation's capital. This is, when all is said and done, a government town. The economy is largely driven by not just those who work for the government, but government contractors or people who sell to government contractors, defense or otherwise. That has always been the case, probably will always be the case. So it's a service economy. You don't see people leaving the federal government to start companies very often. It happens. You don't see people leaving law firms to start companies. So we don't have the ecosystem that one would have in Boston or in Tel Aviv, Israel, or in Shanghai, China, or, of course, Silicon Valley, where people start companies, where failure is accepted. In successful ecosystems, entrepreneurs start and fail, then succeed, and then maybe fail. And there's no stigma associated with that. That's not the case here in the Washington area. So because of we can't change that. We're not going to change that. But it is important for the government agencies and the entrepreneurs, and I want to emphasize that, the entrepreneurs, the CEOs, and the service providers that back them cannot take any of these programs for granted. The biotech tax credit did not emerge suddenly from the government. Government did not create that. In fact, Government largely opposed it. We had to fight it. Unless entrepreneurs are willing to take the programs that already exist and get them to the next level and bring new ones. The programs I was involved with are not exhaustive. There's much more to be done. Then we're going to languish as an entrepreneurial community. We've got to compensate for the cultural, the socioeconomic barriers to being a startup entrepreneur or emerging company entrepreneur in the Washington area. And that's true for life sciences and for all areas.
How would you view the state of the BioHealth Capital Region ecosystem today in our industry that you participate in?
It's in need of improvement. And let me be specific. To me, an ecosystem, a successful ecosystem like you have in the Bay Area of California and in Boston, basically is where the large companies extend a welcome mat to smaller and emerging companies. There's an emerging growing phenomenon of accelerators, corporate accelerators, and you see Johnson & Johnson and a lot of the big Chinese companies like Baidu, the Google of China, are setting up accelerators, and both in the IT companies. By the way, and one of the exciting phenomenon is that as part of this whole AI explosion, a lot of companies that were traditionally not considered healthcare companies are migrating into healthcare. IBM Watson is perhaps among the most well-known, but Microsoft is doing much more. Lenovo has now a healthcare division. So you're seeing a lot more players today that weren't even around 3 years ago. But what I would like to see much more of here is companies like MedImmune, now part of AstraZeneca, or GSK, which bought Human Genome Sciences, taking part of their buildings and creating accelerators where companies can come in at least below market rent, if not free, receive some mentoring, whether there's a legal relationship between the company and the small company is negotiable between the parties, but I don't think we have to get involved in that. But it seems like 98%, every time I hear about an accelerator, it's either in California or Boston. And it's getting saturated there. We need to get more big companies. The ones that are already here, like the two that I mentioned, BD, with big facility outside of Baltimore, and so on. There's a handful, Emergent and so forth. We need to get the blue chip companies, the success companies, to help us become force multipliers.
Other than the financing, which you're trying to address personally with your company, other than the lab space and getting bigger companies involved, is there anything else that you think that we need to do as a region?
Well, I think we should, again, we're not unique. We are part of the other 47. And I think what we should be doing is both at organizations like BioHealth Innovation and the state and county economic development authorities should be partnering with their counterparts in other states that are similarly situated and advance things on Capitol Hill. I think there's much more to be done. I lament that there doesn't seem to be an innovation agenda by and large. There is on a positive note, there is a lower regulatory climate. That's good. The SEC is taking a much more lower regulatory, and I mentioned the FDA, but that's good, but it's not enough. We need to be, for example, right now there's debating on Capitol Hill this tax reform. I don't think there's anything in tax reform about small companies, about entrepreneurship. These are the job creators, right? Nothing, to my knowledge, in there. The theory is that as these large companies bring money back and repatriate, they will invest in R&D. I'm skeptical about that. I think they're just as likely to issue dividends to their shareholders or to do other things. So we need to, as a community, to better engage our senators and congressmen to make these types of initiatives front and center, and that is simply not happening.
One positive thing I'll mention to you is that Governor Hogan formed the Life Science Advisory Board, or reconstituted it, and out of that, it has a lot of leaders from this region on that board. And I think one of the greatest restraints we have that's happened over the last 15 years has been the conflict of interest policy at NIH and the lack of flexibility for, the $30 billion a year of research that's done, which we, the taxpayers, fund, and the ability to find ways to get that great research that's commercializable into the marketplace with a lot of the barriers that exist in working with federal agencies. Do you have any comments on that?
Yeah, actually, I'm glad you mentioned that. So for those that don't know, about, I think, just under 10% of the $30 billion annual budget of the NIH is dedicated to what is called intramural research. So it's
$3 billion a year.
$3 billion a year, sitting right here between Wisconsin Avenue and Old Georgetown Road in Bethesda, Maryland. And it's remarkable. So we have by far the largest life science community in the world per square mile. It's $3 billion a year. Nobody has anything quite like it. Yet we should be seeing dozens, or at least a dozen spin-outs a year coming out of that. I don't think we've seen anything like that. The conflict of interest issue that you mentioned, I think, is perhaps part of it, but it's only a small part of it. I think even if you waved a magic wand, that's not enough. I think what we need, and this may need legislation, this will be controversial, to be sure, but anything meaningful will be controversial, right, and hard. We should have an equivalent of an SBIR set aside as part of that 10%, as part of that $3 billion, where a portion of it, whether it be 3% or 5% or 7%, we can debate that, must be allocated to cooperative agreements known as CRADAs with small and emerging companies. That would not be limited to Maryland, but Maryland would certainly have a competitive advantage because we're physically there, and it's still very, even in the internet era, face-to-face has a lot of value. So I think we need an equivalent set-aside. It's got to be a set-aside. I don't believe NIH would do it on their own. It would have to be a legislative initiative where part of those CRADAs are earmarked specifically for the CRADAs. Normally, CRADAs, the NIH's expectation is that the company brings money to the NIH, not that they, and whether that's right or wrong, most small companies don't have that. There's a lot of overhead there. It's an extraordinary resource, state-of-the-art, beautiful campus, a lot of very smart and dedicated scientists, but largely not entrepreneurial. And with all of the pressure from Congress and others toward what's called translational research, delivering not just papers, but actual products to the patient bedside, I think it's a great time to look at a statutory set-aside for the CRADA program for the NIH's intramural, and that would have a net benefit for Maryland and Montgomery County.
Now, this has really been an interesting interview that we've had with Jonathan Cohen, President and CEO of 2020 GeneSystems, and I'm going to give him the last opportunity to say anything else. It's an open mic for Jonathan. If there's anything you'd like to add that we didn't discuss that you'd like to comment on, feel free right now.
Well, thank you. And once again, Richard, I appreciate your time today. Our first equity crowdfunding campaign is on microventures.com, microventures.com. It ends on December 14th. People that are interested should go to that portal, carefully read. There's videos about our company and things like that. There's a webcast recording and a lot of financial information. Read carefully, consider the risks, but also the opportunities. And if you're so inclined or care to share it with others, we would welcome you to join our company to help us advance our mission of reducing cancer mortality in the United States and around the world through early detection.
Jonathan, I want to thank you for being a committed biohealth entrepreneur to the biohealth capital region and all you've done to help improve the financing environment for other entrepreneurs who are benefiting from a number of new innovative financing programs that are helping them bridge that valley of death. Even though we're not there yet, we're making strides. So thank you very much for appearing on BioTalk. Look forward to following your progress. We'll bring you back later after you get this new one test on the market.
My pleasure. Thank you for having me.
Thanks for listening to BioTalk with Rich Bendis.